Ready.
Okay, so now I'm moving up a little bit more up on the rib and a little bit back on the rib because it's not just a QL issue, it's also an intercostal issue. So I'm literally getting in on the ribs themselves and just loosening up that whole area. And after I loosen it up, I'm going to go in there and try to mobilize her ribs too because they've been stuck down for so long that we need to loosen up the ribs and get them free moving again. She's been having a difficult time breathing and she's been having spasming and everything else. So we're just going to try to get in here and get this thing loosened up as much as we possibly can. That's good. Explain some more things.
Ready.
So I started up on their side. Now I'm working my way more towards her spine, and I'm kind of following that rib line as it comes down. And I'm going to do more soft tissue work. I'm going to loosen up the muscles a little bit more, but I'm just going to stop for a second, and I'm just going to try to like just mobilize the the ribs a little bit. So literally I'm just going to kind of grab her hip right here, and then just kind of see if we can get them to jostle up, loosen up a little bit, and then we'll do some more muscle work. But like I said, because it's been stuck with that muscle for so long, we want to make sure that those ribs are getting nice and loosened up. And we're just kind of loosening them up as a whole. And what we're looking for is a little bit of rebound in the ribs. They should be able to flex and then rebound back. Or I should say like compress and rebound back. Does that hurt at all?
No.
What?
No.
Not too bad? Okay. And it also makes it so that her ribs separate from her hips a little bit more so they can also get into the muscle a little bit easier. Okay.
Ready.
Okay. So I worked the back side here in the QL, but she's still having some tenderness in the front here. And off of these ribs in the front, you have the oblique muscles, like I was saying earlier. The transverse come over the side of here, but the obliques literally come off the ribs, the bottom part of the ribs, and they go. There's the external obliques, and then there's internal obliques. So I'm just going to work out the oblique muscles and work off the ribs to make sure and loosen up this area so that it's equally loose here as it is back here, so we can free up the ribs completely. So I'm literally going to come in through with my elbow again, put my knee behind her back to support her. So she looks like she's falling off the table. And then we're literally going to come off the ribs like this. And anything that has to do with the ribs is extremely painful.
Oh.
Okay, turn. Bed right there?
Yeah.
Uh-huh.
Okay. Go ahead and film this section right here. Right? Okay, so now I'm just mobilizing the ribs again. And I'm going to kind of compress them this way to see if there's still a certain movement that's going to be causing her pain. But she seems to be okay there. It's not going to be perfect today, but we definitely want to make sure that everything is as best we can. Okay, so now I'm going to have her lay on her stomach real quick. And we're still going to do some mobilization stuff with the ribs, but I'm going to have her lay face down and do it. And just kind of come through like this. And I'm trying to kind of move from the center out. And what I'm finding is she's still tense up through here. Is that so tender right in there? At all? Yes?
No.
Yes or no?
Yes.
So it looks like she still needs to get a little bit of work up here because you can tell, like down here, her ribs move nice and well. And then up here, they're still kind of jammed a little bit. So I'm going to work up through this area right here. And we may need to get into her down here a little bit too. Okay, so I'm going to come up here.
Ready.
So I was checking her rib height. Her rib height looks a lot better. This one looks like it's up higher, but then when I was checking her hip height, this hip is still higher than this hip. So I really want to get down The same muscle, the quadratus lumborum, but on this part where it's coming off the hip and going to the ribs, I really want to work right in this pocket right here to loosen it up to see if her hip will drop down and create a little bit more space between her hips and her ribs. So I'm literally going to come down right into here, this little pocket right here. And it's plenty tight through here for sure.
You've really
Helped
Ready.
one side.
helped the one side.
Okay, so I just finished working on this little area right here. Now I'm going to check her hip height, which is much better, and her rib height's still good. But I still kind of want to come in here, get her shirt kind of out of the way, and just kind of stretch between the rib and the hip. See if we can create a little bit of a stretch on that muscle. You doing okay? So we're just going to stretch this a little bit. I'm going to have her stand up in a second, and then we're going to check to see how it looks. Go ahead and turn it on. Just get this whole area.
Ready.
Okay, so now we're done treating the side. So now I'm going to check to see like her rib height. And you can now see I'm on the bottom of both her ribs. And you can see that those are pretty much level. And now her hips are pretty much level also. Another thing we're going to have her do is put her hands to the side. And then go ahead and laterally flex. You can see that she's bringing her hand down a lot farther this time. Go the other way. She's still better this way than she is the other way, but it's still remarkably, go ahead and go this way again, remarkably better. Still feel pain through there? So tight. Okay, so then the last thing we're going to do is have her lay on her back. And we're going to muscle test this thing again. So same thing, have you hold the side. Hold the side for me. There you go. So I'll go like this way and bring it back, so resist me. Okay, relax. Now this way, resist me. And you can see that she's holding a lot better. Now, if she's got QL pain on this side, chances are she's got hip flexor tightness on this side too. The reason why I say that for is because the hip flexor dives through the abdominals and literally attaches to the side of the lumbar spine. And that's the same part where the QL is attached to the lumbar spine. So if this one's tight and pulling the spine forward, it's obviously going to affect the same muscles that are attached to the spine. So we're not going to film this, but I'm also going to work her hip also to loosen up this area so that we can hopefully keep this area loose too. Because if I don't loosen up this potentially could just tighten right back up again. So we're going to make sure and do both sides of this.